hi everyone was watching, and today we have another chapter in Ask the Expert series. This is our 10th chapter. Really happy to be here, and today we have Sam, our lead client care coordinator. So, Sam, do you want to introduce yourself and tell us a bit about how and what you do here?
Hello. So, as the lead client care coordinator here at Right at Home, I'm kind of that first face you meet. I come out and I see you and your family, your loved ones, and help you come up with that plan of care to make sure that you're getting everything you're wanting. And I'm also that main point of contact. So, if you have any compliments, you have any good news about your caregiver, or on the other end, if there's any issues, I'm there to help out that whole process.
That's amazing. So, well, we have an special topic this month because it's Stress Awareness Month
Mhm.
during all this April, and we wanted to grab and pick your mind about stress.
Mhm.
So, well, we know that you have a psychology background and that you're one of the best experts to tell us about that stress. Since you also have been a caregiver before, and we
Mhm.
want to give our caregivers, clients, and all of our referral partners some information and knowledge about stress.
Yeah.
So, can you please tell us what is stress? How do you know when it's becoming too much? So, what the difference is in healthy stress or harmful stress? All of that.
Yeah. So all of us get stress. It's actually a reaction to your surroundings that causes your brain to flood with a chemical called cortisol. And there's ways we can handle it healthily and ways that we don't. So while every caregiver, every family member in a setting where they're caring for someone is going to deal with stress, the biggest way to help you is to lean on those who are around you and ask for support when you need it. Don't wait until you are absolutely burnt out and at your wit's end to ask for help. As soon as you start feeling tired, that's that point you need to bring someone else in on the circle so we can get you that rest that you really need. And then, of course, making sure in your free time that you're not just shoving that stress down, trying to just not think about it. Make sure you're spending time doing things that you love, that you enjoy. Exercise, reading books, getting out into nature. That will all help your brain kind of dissolve those excess chemicals from that cortisol and give you a little bit of relief from that stress.
So, well, in that case, how does that cortisol or that stress affect our bodies and minds in the long term?
Yeah, so stress can have a very big impact on your health. Studies actually do show that being under prolonged amount of stress can actually cause negative health outcomes, higher chances of things like heart attacks, aneurysm, even higher cancer rates. So making sure that you're doing whatever you can to keep your stress levels as low as you can is going to help your health in the long term. And remember, we can't care for someone if we're not taking care of ourselves.
Oh, that's such a good point. And yeah, of course, this is going to have an impact in you. So, what are those unique stressors that maybe caregivers, nurses, or other healthcare workers face that you have seen in your time working with healthcare?
Of of course. So the biggest one for most of us is that we are truly passionate and care about what we do. And with that means we truly care about our clients. And it's very hard to see someone you care about go through a very difficult time. After all, if they weren't going through something difficult, they wouldn't have us in the home to begin with. But making sure that you're balancing that heaviness, that weight of responsibility, with the knowledge that you're doing everything within your power to help this person have a better quality of life. And if it wasn't for you, they'd likely be in a worse off place. So don't let that stress eat away too much at you because you're already doing everything within your power. And we can only do so much. None of us can push too far without hurting ourselves.
Oh, yeah, that's really, really true. And yeah, we see that with our caregivers all the time. Like, people care. When you're tending to others, you're doing that because you truly care and you're trying to get the best out of horrible situations sometimes.
Yeah.
So, yeah, it can be a high pressure environment. So, how do you recognize those early signs of stress or when that stress is going to become a burnout?
Yeah, so a good things to pay attention to when you're having higher amounts of stress is paying attention to things like your thought patterns. So if you find that you're having difficulty focusing on a lot of things, you're having more problems with coming to solutions on issues you're facing, or if you're feeling just all around more tired throughout your day in all things you do, not just work, those can all be signs that you're starting to experience burnout and that we should start getting it under control now before it hits you hard.
Yeah, definitely. So, those simple stress relief tools you talked about before, like doing the things you love, but are there small daily habits that you recommend that can help you build resilience and like just overall help your mental health?
Yes, so there is one thing that is commonly referenced in psychology, and it's really about rewiring your neural networks. And we can all do this a little bit. It takes time and it takes effort, but it does actually work. So when you're having those negative thoughts, when you find yourself getting carried away by that stress, always pair it with a positive thought. So, like I was saying earlier, with the reminding yourself that you're doing everything you can, anytime you're letting that stress get away with you. So, you know, you're the only person coming into care, just pairing that with a I'm doing everything within my power. I'm doing good. I'm doing what I can. Because that positive thought paired with the negative thought, it'll actually help your brain start to think about the positives anytime you automatically think of a negative. So then you're not going to have to force yourself to think positive. Your brain will eventually start doing it for you, and it'll
Oh,
take no
that's
work at all.
amazing. Yeah, we want that. Yeah, we really do need, everyone does need those reminders that they are doing everything they can. And if your brain does it for you, I think it's a good daily habit for you to start doing. So I will say also write it. Sometimes for some people, writing
Mhm.
things is going to even make more impact and the brain to internalize that better.
Yes.
So yeah.
Yeah, and journaling is one thing that's in that process, but it also can be done through art, through reading poetry, anything that you connect with that leaves you with that positive feeling.
Oh, yeah, that's really, really nice art. Yeah, and you can even do it with your client. They actually love that, and I
Oh,
think it will
yes.
be helpful for them as well.
Oh, yes.
So now, as healthcare employers and teams, how do you think we can provide better support to staff regarding mental health, and can we reduce that stigma around mental health and stress in the work environments?
Yes, of course we can. So a lot of the stigma around mental health is really just a lack of understanding that our brains get sick just like the rest of our body. People who have chronic depression are suffering from a lack of blood flow, a lack of chemical reactions in the frontal lobe of their brain. And that shows on medical imaging, just like you can see a broken bone in an x-ray. So just a clear understanding that what this person is going through is not something that they're choosing to do, it's an illness that is affecting them. And then just understanding those symptoms and putting them in the right frame. Just like you wouldn't get upset with someone who has a broken arm because their arm hurts. We probably shouldn't be getting upset with people with depression who don't have motivation because it's just a
Oh,
symptom of their illness and we can
love
help them push
that.
past it.
Oh, lovely. Yeah, I think a lot of people right now just felt validated because, yeah, it's a real pain. And having a mental illness and health illness is really difficult. And yeah, you're totally right. We should be helping people, not judging them. That's
Mhm.
what everything we do. Like we care
Yes.
no matter what. So, what's something you wish more people understand about stress, mental health? Any last thing that you want people to um, recall from this little conversation we had?
Maybe not something to recall, but one thing that I've always found helpful for trying to understand others' mental health. always take a moment to put yourself in another's shoes. Take a moment to think about their life circumstances, what they've been through, and how you might react in their situation. You'd be amazed how much you can really discover when you turn the tides and you find yourself looking at the same situation they're facing. And it can really give you a whole new perspective and help you relate a lot better.
Hmm, amazing. Yeah, leading with empathy.
Mhm.
So thank you so much, Sam, for all the amazing things, tips, and explaining what is stress and mental health in the healthcare field is. So thank you so much. Hopefully, this is going to be helpful for a lot of people in our audience. So remember, if you have any questions, just leave that in the comment. Make sure that you are subscribed, liking, commenting, so we can continue to do this content for you. And of course, if you have any questions, we have a lot of healthcare professionals here that can give you some tips and advice. And if you do need something urgent, make sure that you're reaching out to the professionals that are around you and close to you so you can address those. And we can fight this. Mental health is something we need to take care every day. As long as we are taking our physical bodies, we need to take care of our minds and our souls. So have an amazing day, and yeah, let's not stress about it.
Thank you,
Bye.
everyone.
Thank
Bye.
you.